Okay, I wanted to talk a little bit about urinary tract infections. Um, now, basically, urine should be in a fairly sterile state. Um, uh, there could be some, a small amount of bacteria present, but because of our immune system, it should be kept in check and shouldn't cause an illness. Once the bacteria invade the bladder, then you have a urinary tract infection. Um, uh, the urinary tract goes from the kidneys all the way to the outside. And so sometimes the bladder infections can back up into the kidneys, and this is a much more dangerous condition. Uh, now, there are plenty of women who've had an occasional urinary tract infection. Take some antibiotics, no big deal. But urinary tract infections can actually be serious in some cases. Like I said, sometimes somebody who's young, they have a urinary tract infection, they just, go to their doctors, get a prescription for some antibiotics, everything turns out great. For a man, most common cause of urinary tract infection would be an infection of the prostate. And again, antibiotics will clear it, not a real big deal. The problem happens when people get older. Then urinary tract infection can sometimes be life-threatening. So one of the common causes for a condition we call sepsis, which is bacteria in the bloodstream, is a urinary tract infection. You have somebody who is, let's say, 80 years of age, and they develop a urinary tract infection, and that infection goes into the bloodstream, and now it becomes a life-threatening type condition. Person can wind up in the intensive care units because of a urinary tract infection. Now, if the antibiotics are started right away and the patient is supported, everything can turn out all right. But usually when you have bacteria in the blood, the person can have a drop in blood pressure, and because of that state, a lot of bad stuff can happen. I saw this many times when I was in my practice. People who would go in the emergency room would wind up, not even conscious because of a severe urinary tract infection that went into a septic state, and you weren't really sure whether they were going to survive. You were hoping that the antibiotics were going to work fast enough. So urinary tract infection could be something that's mild, or annoying that you just have to make an appointment with your doctor and get checked out, or it can be something serious. Women have a more likelihood of developing urinary tract infections just because of the anatomy. The bladder wall is right next to the abdominal wall, and so the urethra in a woman is only a very short distance from the bladder to the skin surface. And because of this, it's easy for bacteria to back up into the urethra and back into the bladder. So it's not unusual for a woman to have a urinary tract infection on occasion. For a man, because of our prostate, it's a little bit harder for bacteria to get into the bladder. Our prostate produces a chemical that kind of sterilizes the urethra. And because our urethra is generally longer than a woman's urethra, it's a little bit harder for bacteria to back up all the way into the bladder that way. And like I said, it has to get by the prostatic juices, which are which kill bacteria. So the best thing that people can do to try to prevent bladder problems and bladder infections, drink lots of water. If you wash out the bladder with lots and lots of water, bacteria can't stay around long enough to cause the infection. Okay, take care.